We are also recording this, and the recording will be sent out within 10 minutes following the briefing. So we ask that each of you remain on mute so we can get a clear recording. Okay, I'm going to go ahead and turn it over to Dr. Wu. Thank you, Dr. Wu.
Morning, everyone. Everyone can hear me okay? Well, thanks everyone for joining. We are in a year and a half into this pandemic, and we're entering a new and exciting and hopeful phase. In the past day, we've heard the great news that the US is donating $500 million worth of COVID vaccines to the world. This is excellent news that comes just as much of the world is opening up to travelers again. France has just announced that it is opening up for global tourism, including for US vaccinated travelers. Certainly, there are remaining questions and concerns. Some countries are still in the midst of significant surges. Others, such as India, have only recently seen their numbers decline. Variant viruses of concern, including the Delta variant, are present and even in the US. How should a US resident stuck at home for most of the past year, ready to hit the road, looking to do that trip that was canceled or take advantage of a great travel deal? How does the US traveler approach this new phase? First of all, if you haven't gotten it yet, I really strongly advise everyone to get vaccinated when it's available to you. The COVID vaccines have proven to be effective and safe. With 6 months of data since their rollout, serious side effects from the vaccine are proving to be extremely rare, while more and more studies show how many deaths were prevented with vaccination. Over 170 million doses of vaccines have been given in the US. This gives them a bigger track record than many of the long fully approved vaccines that we use in travel medicine. I mean, how many persons do you know that have actually received the cholera vaccine? Increasing data suggests that our vaccines are effective against variants, including the Delta variant. And to this day, all the vaccines used in the US are shown to be effective. And when there are breakthrough cases, the illness is almost always not severe. Where should you travel? Certainly do your research. Countries in the midst of serious surges are not good choices. Even if you are vaccinated, should you need healthcare during your trip, whether it's a car accident or an unanticipated heart attack, you become a burden to a struggling health system. Start planning by reviewing CDC's travel recommendations. The number of countries that are coming off the highest risk level is increasing. So the world really is opening up, and the CDC is your best source of up-to-date information. Furthermore, check the requirements for the destination. Check the embassy website. Check with our State Department. Most countries still require testing prior to travel, even if you are vaccinated. Get your documents in order. This includes your CDC-issued vaccination card for your COVID vaccine. I might even keep extra copies of it and scan them and store it in the cloud just as a backup. Stay up to date with any developments regarding digital health certificates that might make your travel easier. Remember that you still need a negative test within 3 days of boarding a plane on your return to the US, even if you are vaccinated. And it is still recommended to get tested again after your trip and to monitor for any signs of illness. As usual, whether or not you've been vaccinated, I'd suggest everyone still practice the good habits we've learned in the past year that protect us all from infections, not only COVID, but also the flu and common colds. Of course, this means hand hygiene, cough etiquette, distancing, and even masking. These are effective tools that you can use to further protect yourself. COVID prevention is all about layering multiple strategies. Think of the vaccine like a great raincoat. It might be very good at keeping you dry, but when there's a heavy downpour, I'm going to grab my umbrella before I go out the door. Regarding masking, airports and airlines are still requiring masking for all passengers, including vaccinated ones. And although CDC has suggested that vaccinated persons can do most activities without a mask, I suggest travelers take a more nuanced, informed approach. When you are in situations that are a higher risk for COVID transmission, say a crowded indoor space with a mix of people, I would advise wearing a mask, even if not required. Better yet, now that summer's here, I opt for outdoor activities whenever possible. And outside, I'm very comfortable being without a mask. Although breakthrough infections are almost always milder, And these vaccines are extremely effective. Remember that you need a negative test before you get on that plane home from overseas. So that mask might save you a big headache. In short, the world is opening up. Travel is increasingly possible, and some of us really need to visit loved ones in person or just get away for our own health. However, there's a chaotic mix of different requirements, and they are rapidly changing. So do your research and stay flexible. If you are a traveler that likes more predictability on your vacation, opt for domestic travel or staying local. Wherever you visit, be mindful of local regulations and the local conditions. If you have health conditions that do predispose you for severe illness, or that could affect how well the vaccine works in you, it still might not be a good time to travel. Above all else, get vaccinated. It's still one of the most important things you can do to protect yourselves and end this pandemic. And with that, I'm happy to take questions.
Great. Thank you very much for that, Dr. Wu. We'll stand by for any questions. As a reminder, go ahead and enter any questions you have into the chat function. Stand by. Okay, we have our first question, Dr. Wu. Do you make any distinction based on type of travel, cruise or air travel?
Great question. And certainly, yes. Cruise is a very interesting one. Certain cruise lines have made a mandatory vaccine requirement for all passengers as well as crew. Some have relaxed, some of these backtracked a little bit, but others have a very clear requirement. So certainly travelers should take note of that before booking any cruises. Air travel, of course, the same advice I've always given in the past year, follow the masking regulations. If you want to be extra safe, again, minimize the amount of times you need to take your mask off in the aircraft. Again, even if you're vaccinated, I always like to take those extra precautions. Road trips could be the safest in the sense that you have full control of your surroundings. But again, plan ahead. Crowded areas in general, I would still try to avoid. And again, the vaccine certainly opens up a lot of doors, but again, the layered approach is the best way to prevent any infection, even a mild or asymptomatic one.
Great, thank you. Next question. Do you have any thoughts on whether the U.S. should start opening to international travelers?
That's a very a good question. Certainly, there are many economic sort of needs and things which I'm obviously not a expert in. My best advice is that in travel medicine, we think of the world as really connected, and infections around the world with international travel certainly do can potentially become a problem here. And that applies to whether it's our own people traveling abroad or others coming over to the US. I do trust the CDC in thinking through this carefully, in whether it's requirements or restrictions, to really make sure that we do not introduce potentially new variants or strains that could be a bigger challenge to our health system.
Great, thank you. Next question. For people wanting to book that international flight as soon as they can, when do they have the green light, in your opinion, with safety in mind?
Yeah, I think it boils down to first thinking about yourself and your personal risk tolerance. Again, if you have risk factors for more severe illness, whether it's being advanced in age or having medical problems, if you have a condition that might make the vaccine less effective, whether it's being immunosuppressed from a transplanted organ or other treatments, you may still opt for booking a trip that's a little more safer, whether it's a local trip or a domestic one. Otherwise, I think the important thing is flexibility. We've seen this pandemic change in many ways, often for the better, but sometimes in unexpectedly worse ways. So If you do need more certainty, it may be a little not the best time to book a trip. Certainly look at cancellation penalties or fees, if any, whether it's for air travel or for hotels. So be flexible. If you are a traveler with a higher risk tolerance and you are flexible, it may be a good time to start planning that trip.
Great. Thank you. Next question. Any advice about travel with young children who aren't yet eligible to be vaccinated?
Excellent question. I do. The good news is this. Obviously, increasing data shows that illness in children almost always is mild, even though there are rare deaths and hospitalizations. The concern for children is a bit less. However, we also know they can pass infection, and even a mild illness is something we'd like to prevent. For that reason, I would advise that travelers with children do think through this carefully. I do think children, it may be best to travel children in more controlled, lower risk situations, whether it's local or domestically. If you do travel, wherever you go, again, continue to follow the masking and distancing guidelines that particularly apply to unvaccinated persons.
Thank you. What international destinations do you feel are the safest for travelers?
Oh, wow. Well, I'm gonna not mention specific countries, obviously, for a couple reasons, other than I'm sure I'm going to forget a good country and get in trouble. But reality is things change very rapidly. I think what I would look first, I would go to the CDC's travel website, look for the countries that are in the lower risk levels for COVID. These will be the countries that have decreasing numbers, whose healthcare infrastructure is doing okay, where and also they are opening up for travelers. And then again, it kind of goes to your personal risk tolerance. I think some countries have had very low numbers, especially in the recent past, and some throughout this pandemic. And those obviously, if they're open, might be the safest of places. But I don't have a one size fits all. Certainly much of Europe is opening up. And there certainly still are cases in Europe, as there are throughout the US. So I think just taking a very careful, informed approach and picking your destination carefully. And remember, it's not just about COVID risk. I mean, in the field of travel medicine, we've always known about different levels of risk, whether you go to a high income country versus a lower income country. There's, with other tropical infections, I mean, there's always things to consider. I would always suggest folks check with CDC and even consult your local travel health provider.
Right. Some people are skipping a second shot for whatever reason. Any advice for people vaccinated with only one dose of a 2-dose vaccine who are considering travel?
Yeah, the quick advice: get that second dose. Even if it's late, it's certainly something I would do before your trip. I think for the 2-dose vaccines, the first dose does offer you protection, but why settle for partial benefit when you can get the full dose of the full benefit with that second dose? So unless there's a medical reason or an allergy that precludes that second dose, I certainly would get it.
Okay, and how should the Delta variant factor into travel plans, including for vaccinated travelers?
Well, I think, the good news is that the increasing evidence suggests that, our vaccines are effective and that they can prevent severe illness and probably most infections from the Delta variant. I can't say that all the data is there and there's 100% certainty about all these questions. So that's why I would always suggest taking your extra precautions, whether it's masking up in high risk situations or maybe avoiding countries with high levels of transmission. And the reality is that, and we just heard that this Delta variant has been detected in our home state of Georgia. So you really don't have to travel far necessarily to come close to it. But as a travel health epidemiologist, I'm always suggesting folks look for the lowest risk, situations that fit your needs. So again, I certainly wouldn't go to countries such as India or places are having high numbers of cases of variants for many reasons.
Great. Do you have any concerns moving through the summer and into the fall?
Well, as an infectious disease epidemiologist, I'm always, thinking of all the potential, concerns and pitfalls in weeks and months ahead. Certainly, I am very concerned that our vaccination rates here at home in the U.S. are slowing down. I would love to see more uptake, because I think it is the best way for all of us to protect ourselves and to really reduce that risk here in the U.S. And potentially allow us to open our own borders up more. I think the reality is these vaccines are fantastic, including against all of the known variants. Does that preclude something down the line in the future that is more resistant to our vaccine? It certainly doesn't. So what I'd like to see is the whole world to control their epidemics, and therefore reduce the likelihood that new variants in the future that are even more that are resistant to come up. So all the more reason, take your precautions, and also thank our government for investing in helping the world with vaccination.
Right. Do you think the pandemic related travel guidelines would be permanent for international travel? Or do you see international travel ever looking like it did prior to the pandemic?
Well, it's tough to predict the future. I think, the at least for the COVID-19 pandemic, we are in a trend really towards opening up, having more and more tools to prevent infection. We've learned a lot in the past year with our vaccines and our prevention measures. So I think in many ways we are learning how to get back to normal life, despite COVID-19 still being present. Again, we certainly can't rule out that somewhere in the future, a new variant that is a little more difficult to deal with does emerge. We also and in my field, we are always worried about the infection that we aren't predicting, whether it's, MERS or a new strain of avian influenza. I mean, long before we knew of COVID-19, that these were some of the viruses we were most worried about. So the reality is, in a world that is connected, pandemics are always a possibility. The fact that we are even more connected now than we were 100 years ago does mean that these may happen more frequently. So it's really all more important that we really support our public health institutions, make sure they're well funded, so that we can always adequately prepare and deal with them.
Okay, Dr. Wu, here's the final question for you. And if you didn't think you were going to get this one, the question is, would you travel this summer?
Okay, excellent question, and always a fair one to ask what I'm doing. Okay, I have actually not gotten on a plane in the past, a year and a half since this pandemic started. Now, I've been vaccinated for over 6 months, and I've been actually itching to get on a plane to visit my parents who live in Hawaii. They are elderly. I've not seen them in over a year and a half, and I really would like to see them. They're both vaccinated too, so I think traveling is very safe for me to go see them, and I've been trying to do that for the last 6 months. But in all honesty, my pandemic dog that I adopted in the past year is proving problematic to put into boarding, so that's what's keeping me from booking my trip. But I hope to do that in the next month or so.
We'll save the story more about the pandemic dog for another media briefing. Okay. So we'll go ahead and wrap up here. And Dr. Wu, do you have any final comments?
No, except that again, really vaccination is the key for everything, not just travel, but also our own daily lives are getting back to normal. But at the same time, don't forget all the lessons we have learned. I think, the masking, the respecting distances. I think some of these are good things. They certainly do also prevent things like colds and flus, and less infections of any sort is better for all of us.
Great. Thank you so very much, Dr. Wu. Everyone, thank you for joining us today. As I said earlier, we will go ahead and send a recording out of the briefing and within the next 10 minutes. If you have any follow-up questions, reach out to Catherine Morrow. You have her information. Otherwise, everyone have a wonderful day. Thank you.
Bye, everyone. Thank you.
Recording stopped.